Doctor, I just want to say it's really easy to take the road out of a news cycle like this and just be like, thoughts and prayers and move on. It's very hard to do what you did yesterday, which was to be the first medical professional to come forward and say, this isn't right. Clearly, someone's lying here. And we just want to thank you for doing that. You sort of started a lot of people thinking in a diagnostic sense about this with Joe Biden.
Well, thanks, Benny. And that is, for good or bad, that is the nature of what I do. Is when I see a medical situation, I examine it, I look for patterns or that sort of thing. And this one stuck out like a sore thumb because it's in the 1 or 2% range when you go from being told you have a normal prostate exam to having metastatic disease, 12, 13, 14 months later. So you are either, in medical school, we learn if you listen to hoofbeats, you should think of horses, not zebras. So the likelihood that he actually had a normal prostate exam 12 to 13 months ago is very unlikely. And then you start to see things unwind. And I've done some additional work on this over the last day or two. The drugs you would use for metastatic prostate cancer are called ADT. So they suppress testosterone levels, androgen deprivation therapies. And the major side effects are falling down because you lose muscle, you lose balance and that sort of thing, and cognitive decline. And this is in peer-reviewed publications. So there may be more to this story than simply we weren't told he was diagnosed at the time he was president. He might have actually been treated during that time, and what we saw in his behavior and cognition might have been side effects of the treatment.
So you're saying that they were covering this up. They knew about it even when Joe Biden was running for president. That's, by the way, backed up by Dr. Emanuel on Morning Joe this morning, saying, and his entire family ran the Obamas and the Bidens, so you'd assume through the grapevine he'd know. He said it's likely that Joe Biden had this cancer while he was running for president in 2020 and 2019, that it was well known and that they were trying to hide it from the American people, which seems deeply unethical.
Yeah, well, in 80 to 90% of the patients who have metastatic disease, the diagnosis was made 5 to 7 years earlier, and that's just what the peer-reviewed papers say. So we're talking 2018, 2019.
And so the treatment, one of the more popular treatments you're saying here, leads to cognitive decline and muscle atrophy, so you might have a lot of falling or brain fog.
That's correct. So let's think about this. There's 4 major cancers: breast, lung, prostate, and colon. Prostate is unique in that it has a very simple blood test that you can use to follow, and the level in the blood test is sort of a linear relationship to the mass of the prostate tissue, and then benign tissue makes less PSA than prostate cancer tissue. So there's some really easy ways to follow this. Now, the way you stop prostate cancer early on is because it's driven by testosterone. You take away the person's testosterone. You basically take away all of their testosterone, and the cancers will stop growing. But the side effects of not having testosterone is you lose muscle mass, maybe 30-40% of your muscle mass. 37% of all men on ADT will have a fall during a year of treatment. And it also has been demonstrated in a very strong study that there is declines in cognitive function. All of the parameters of cognitive function are decreased by this ADT treatment. So in retrospect, we may have been seeing side effects from pharmaceutical treatment of prostate cancer.
I think that really explains Joe Biden's behavior. His behavior has always been so curious and strange, humiliating, and hard to watch, Doctor.
Well, it is, Benny. And before I get too far in there, I wanted to start to just say, look, this is a tragedy, whether irrespective of politics. He's a man, he's a father, he's a grandfather, a husband. So we feel for the family. We wish him the best. Our prayers are with him. But then as a diagnostician and a clinician, we do want to examine how we got here and whether maybe some of the things going on was more sinister than we thought, which is to say he was actually being treated for a condition, and the side effects of the treatments may have led to some of the things that we saw and no one explained to us.
What do you believe is the medical probability that his doctors knew that this was happening, specifically his personal doctor who had been with him for decades, Kevin O'Connor?
Well, if you do the reverse of the statistic I said, which is 1 to 2% of people will go from a normal prostate exam to metastatic disease, then the fact that he's not in that 1% means it's a 98% probability that his physicians knew, because I again 98% of the time his prostate exam would have been abnormal last year. So prostate cancer starts in the prostate. The prostate has a nice little capsule. It grows in there for some time, and then it grows locally in the pelvis, in the lymph nodes. So it's local disease, but not metastatic disease. And then only then does it go into the lymph nodes, blood vessels, into the spine. So it's a two-step process out of the prostate, has to grow in the prostate, around the prostate, and then into the bones. And as I said, 1 to 2% of the time that happens in 12 months. 98% of the time it takes 5 to 7 years.
So is it malpractice that we're looking at? Do you think that his doctor didn't do the test, or do you
Uh,
believe that it's more likely that his doctor knew and was covering it up?
Yeah, just again, I'm not a lawyer, but malpractice is the improper treatment, improper care between a doctor and a patient. So I don't believe it was probably malpractice, because I'm sure they would have done the PSA test. It would have been malpractice not to do that test. You do the
Mhm.
test, you do a digital rectal exam, which allows you to feel the size of the prostate and its contours and its hardness. There's a sandpaper feel to a cancer that you don't have with a rubbery enlarged prostate. But all of that is absolutely routine. Um, I mean, it'd be malpractice in the middle of the smallest town in America. So at the Bethesda or some of the other places, and if, for a senator, vice president, president not to have his prostate followed um, would be malpractice, and it just didn't happen. It was followed, and we weren't told about it.
So you firmly believe that. What consequences are there medically for something like this? It does seem to be a constitutional crisis to keep the health of the president so secret from the American people. I mean, Joe Biden was running for president through last July, and we were being told that he was in perfect health.
Yeah, I mean, Benny, I'm going to try to stay in my lane, in the doctor lane, and
Sure.
I do think that there probably is just a citizen. I think I probably have a right to know about this as a citizen, to make a vote on that sort of thing. Um, but so that
Do you think that?
that's my 2 cents worth, but outside the medical
Mhm.
range,
Do you think that Jill Biden knew?
of course.
I,
Yeah,
it seemed.
because an enlarged prostate, prostate cancer is going to have sexual dysfunction factors. You're going to have, getting up in the night 2 or 3 times. You might have blood in the urine. There's lots of symptoms around urinary function that a spouse, that a partner would know about.
And so, what is to be said about? I suppose, and maybe this is more of a moral and maybe a personal question than a physician's question, but it seems like a very bad thing to do when somebody is suffering through cancer like this, to do TV shows or add a bunch of extra pressure to that individual, like the pressures of the presidency, perhaps.
Yeah, no,
Seem
I think probably you are going to want to take care of the person first as much as you can, and putting them in situations that they're not capable of functioning at their best is not good for them. And of course, in this situation, you're putting them in a position of great power, great authority, great responsibility. And there's a moral or amoral aspect to that. I think you get there pretty quickly.
yeah. A final question for you, and this does have to do with the inside of your lane in your specific practice. What is going to happen next with Joe Biden? They say they're
Yeah.
reviewing treatment
Mhm.
options in their press release. What does that mean exactly, and what is the likely outcome here?
Sure. Let's go back, because I think it's important. You have lots of listeners, and every man who's listening has a pretty good chance of having prostate cancer at some point in time. So remember, it grows in the prostate, and it's completely curable when it's there. It goes through the capsule and is in the pelvis, the lymph nodes. It's highly curable there, but when it gets to the bone, it's not curable. You can ameliorate it, you can slow it down. So Because it's dependent on testosterone, ADT works very well for about 2 to 3 years.
Mm.
And then, almost like clockwork, Darwin steps in, and because it's under pressure to grow, it wants testosterone, but it can't grow. It will select internally for a cancer that doesn't require testosterone. It then escapes ADT. It's called castration resistant. It's a funny way to describe it, but it's from the days when we castrated people rather than gave them a drug to take away their testosterone. Then you're in the range of chemotherapy. To try to stop it from growing. Now, if there's only a couple Mets in the spine, they can do some really selective radiation, which again is going to kill it, stabilize the spine. But it's a pretty intensive. He's in an intensive medical situation now, probably for the rest of his life.
You say it's uncurable when it gets Mets to the bone.
At this point, at this point in time in medical care, yes, all we can do is we can't cure it, which is to say, make a person cancer free, and they effectively die of something else. Once it's metastatic, and this is true of all cancers. That's, at my company, Atosa Therapeutics, I'm working on metastatic breast cancer. Same situation. If we catch it in the breast, it's 96% curable, and when it's in the bones, it's 25%. 5-year survival. So this is the nature of this stage in cancer's growth.
Well, thank you, Doctor, for coming on the program, and we hope that you're back. We'll see if this pardon against Dr. Fauci stands up to constitutional rigor. Maybe we'll have you back and you can talk about Dr. Fauci.
Well, we can, or we can talk about my book on the origin of COVID, which is called The Code as Witness, coming out in the fall. So, and most importantly, I'm going to talk about what we need to do to prevent the next pandemic, which will not likely be a 1% lethal virus, but might be something much more serious.
Here we have your website, right here. The Good Doctor's website, his biography, his work, where you can find his book on COVID. I didn't actually know that, Doctor, so thank you for noting that. We'd love to have you back on for that. There it is, right there. Stay safe.
Yeah, well, there's a new one coming out. I testified 3 times in Congress about the origin of COVID in the past couple of years.
Well then, Doctor, that's a guaranteed booking back, because that's exactly something that we cover on this program all the time. We found the Doctor on X. Here's his X profile. 20,000 people follow Dr. Stephen Quay. And he's going viral now for all the right reasons, for simply being a truth teller. And that's a brave thing in his profession. And we thank you, Doctor, for being on the program.
Thanks, Benny. Take care.